The hip pain receives a special mention, especially in the post-COVID era, because some of the patients who have had COVID-19 and who are hospitalized and have been prescribed steroids, there is a condition called avascular necrosis of the femoral head. What does it mean is, because of a steroid intake, which was necessary during your COVID treatment, it is lead to a complication known as an avascular necrosis, wherein the blood supply to the head of the femur, basically it's the femur joint, the ball of the hip, the blood supply is reduced, which causes pain. So especially if you have had COVID-19, in case you were hospitalized or you were administered steroids, not just for COVID-19, there are many other reasons for which people take steroids. For example, in case somebody is suffering from rheumatoid arthritis, any kind of an immunological disorder, psoriasis, asthma, these are the people who have taken some form of steroids. Any form of steroid intake can lead to a avascular necrosis of the head of the femur. So what does this mean is, patients who have this experience hip pain. The hip pain will be present especially when you're sitting and getting up, when you're trying to get on the bike, when you lift your leg up, and then when you're sleeping, when you turn on either side, it leads to a hip pain. So this hip pain should not be ignored and should be tackled earlier. Why should it be tackled earlier is, the condition what I'm talking to you about, avascular necrosis, progresses through 4 stages. Stage 1, stage 2, stage 3, and stage 4. Stage 4 requires something known as a hip replacement. If patients can be picked up earlier with an avascular necrosis, it can be, the progress can be curtailed for a certain duration by doing a few interventions. And coming to what Dr. Namita mentioned about what is the role of hip replacements and revision hip replacements. These are surgeries done in cases of patients who have had arthritis of the hip. The arthritis can be degenerative. When I mean degenerative, it means hip pain in older age, or it can occur in younger patients, especially in patients who have other diseases like something like ankylosing spondylitis, rheumatoid arthritis. It could even be because of some fracture around the hip region, and of late with avascular necrosis of the hip. But even when it comes to hip replacement surgeries, there's absolutely nothing to be worried about. These surgeries have been some of the most successful surgeries of all time. My hip replacement surgeries, maybe in the youngest patients, I've done hip replacement as young as 17 to as old as 92. So it's a varied range, and all of them generally do well. And then the third aspect of the question is revision hip replacements, is what Namita talked about. Revision hip replacements are the next set of surgeries which are done when some hip replacement surgeries which are done have not been performing to their expected capacity, or in cases there is an infection, there is something called as a hip loosening. Then there is the scope of the revision replacements, but till that time, absolutely it is not really necessary. So the only information you as youngsters you need to know is the existence of a terminology called avascular necrosis of the hip, and hip replacements are very successful surgeries. These are the only things I think that need to be known.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.